Welcome to Mental Health Mini number 4, where we'll talk about the mental health theorists and nursing theorists that drive psychiatric nursing practice. To start off, we have our biological theories of Darwin and homeostasis. Darwin proposed natural selection, which meant that only the fittest survived, as well as macro and micro evolution, and he observed this through visiting different islands in the Galapagos and discovered that on each of the different islands, the animals had certain characteristics that helped them to survive on that island and that had developed over time. We primarily use Darwin when we look at coping skills and helping people to grow and develop to be more adaptive to the situations and symptoms they're experiencing. Homeostasis is a self-regulating mechanism that helps our body to maintain internal stability. It may be affected by mental illness and mental health treatments. Different types of homeostasis that we see is our drive to maintain a normal temperature. We have our sex and hunger drives, our body's ability to maintain a proper glucose level, blood pressure, and electrolyte levels. As I mentioned, we primarily look to homeostasis when we see the effects of mental illness and certain medications that we provide for those illnesses. Then we have our psychodynamic theories. Primarily, and the most popular one is Freud. Freud had created the psychoanalytic theory, which drove psychoanalysis therapy. And basically what this meant was that we have certain needs and drives and conflicts that we're not consciously aware of. And we need to find ways to subconsciously bring that to our consciousness so that we can cope and deal with it. He looked at different mechanisms like hypnosis and dream analysis to identify those conflicts and needs and to resolve them. He also proposed the id, the ego, and the superego. He is the basis for identifying different types of anxiety responses and defense mechanisms. He also had a lot of theories on sexuality and how we're sexually driven to certain individuals. And then he also created the concept of transference and countertransference, which is going to be a key aspect of psychiatric nursing. Transference occurs when our patient perceives us as being where they subconsciously associate us with someone else and they treat us based on that individual. So it may be a positive experience or it may be a negative association. Countertransference is when the nurse perceives the patient subconsciously as similar to someone else and treats them based on that. Another psychodynamic theory, which is sometimes a developmental theory as well, is Erickson. Erickson proposed different stages of psychosocial development that you have to meet within that stage to develop certain virtues. So for example, from infancy to 18 months, the child is working on building trust or mistrust. If they are provided with the trust that they need and are able to develop that psychosocial task, then they develop the virtue of hope. From 18 to 3 years, they're developing autonomy versus shame and doubt. If they reach the autonomy stage, they'll develop will. 3 to 5 years, we're looking at initiative versus guilt, with the virtue being purpose. 5 to 13 years is industry versus inferiority, with the virtue being competence. 13 to 21 years, we're working on identity versus role confusion, with the virtue being fidelity. From 21 to 39 years, we're looking at intimacy versus isolation, and the virtue that we can develop is love. From 40 to 65 years, the psychosocial crisis is generativity versus stagnation, with the virtue developing being care. And then after the age of 65, we work at integrity versus despair, with the virtue being wisdom. Cognitive behavioral theories that are most popular are Pavlov and Skinner. Pavlov created something called classical conditioning. And what he discovered was that our body has unconscious stimulus and responses. So for example, he noticed that whenever food was placed in front of a dog, the dog started to salivate. He wanted to determine if through classical conditioning, he could get that dog to salivate based on a stimulus that wasn't food. So what he did was he took a bell or a whistle. You can use either one, and you can use a lot of different neutral stimulus. So initially, that did not cause the dog to salivate. However, when they paired the whistle or the bell with food, then the dog was classically conditioned to salivate at either the smell of the food or at the sound of the bell or whistle. So then afterwards, they could blow the bell or the whistle and not provide the dog with the food, and the dog would still have that same response of the drooling. Skinner did a different type of conditioning, and it was called operant conditioning. And this is based on reward and benefit for different actions. So what they did is they trained a rat to press a lever to dispense their food. That was the reward. Every time they touched the lever, they received food. However, there's also an electrical grid where if they tried to cross a certain line, they would be shocked. That was a negative association or a punishment. So it trained the rat to press the lever instead of trying to escape the box so that they could get the reward that they wanted. Then we have Albert Bandura. Albert Bandura came up with two primary theories that we use in psychiatric nursing. The first one is the modeling theory, and this is his belief that we learn through imitation of others. So we watch what people are doing around us and we mimic that, and that drives our behaviors and our interactions. In psychiatric nursing, it can help us to identify patterns of behaviors, especially related to violence, how people cope, and use of substances. It can also be used as a tool to help improve our patients' behavior. In nursing, we are responsible for modeling healthy and good behaviors so that if our patients are unsure of how to act in a certain situation, they can look to us and imitate our behavior to help them build social and self-coping skills. The other theory that Bandura presented was the theory of self-efficacy. So self-efficacy is a person's sense of their ability to deal effectively with a situation, a topic, or an environment. It influences how people think, feel, act, and use motivation. Then we have our developmental theories. Like I said, Erickson is often considered a developmental theory as well, but here we're going to talk about Piaget's theory of cognitive development. And basically Piaget said that people understand and learn differently at different phases in their life. From birth to 2 years, they're in the sensory motor phase, and their whole aspect of learning is trying to understand the world through their senses and actions. From 2 to 7 years, they enter the pre-operational phase. This is where they understand the world through language and mental images. And then from 7 to 12, they reach the concrete operational phase. And this is where they understand the world through logical thinking and categories. This is a very black and white thinking, and they're not often able to think outside of the box. That develops in the formal operational phase, which is 12 years and onward, where they understand the world through hypothetical thinking and scientific reasoning. One criticism of Piaget's theory of cognitive development is that it's not adaptable to individuals that have a developmental delay or sometimes are affected by different mental illnesses, traumatic brain injuries, things like that. We use this in nursing to identify where our patients at on their cognitive development so that we can tailor their education based on their cognitive needs. Then we have our humanistic theories, primarily Maslow's hierarchy of needs. And Maslow's hierarchy of needs is a pyramid that shows that you have to reach certain needs before you can move on to the next needs. Psychological needs are our basic needs of needing air, water, food, shelter, sleep, clothing, and the ability to reproduce. Before we can move on to our safety needs, all of our psychological needs need to be met. Our safety needs is having personal security, employment, resources, health, and property. After that, we can move on to love and belonging, where we focus on friendships, intimacy, family, sense of connection, and feeling part of a community. After that, we can move on to esteem, which is the way that we respect ourselves, how we feel our self-esteem is, our feelings of status, recognition, strength, and freedom. And after that, we reach a concept called self-actualization, which is when we are the most that we can be. Characteristics of being self-actualized is having a realistic perception of reality, having acceptance of oneself and others, being able to manifest spontaneity, being able to problem solve, having a desire for privacy and detachment, being able to feel emotions, seeing life as worthwhile and beautiful, having satisfactory relationships, having a strong sense of morality and a sense of ethics, being able to be creative and independent, and being able to live knowing based on your wants and needs and not conforming to others if it conflicts with who you are. Maslow's hierarchy of needs is really, really important in psychiatric nursing because if our patient is hallucinating and they don't feel secure, then we can't send them to a group where they're focusing on esteem issues because they haven't met those safety needs yet. So it gives us a guide to knowing and understanding what our patients' basic needs are before that we get them to a place where they're reaching self-actualization. Another thing that it drives us to in psychiatric nursing is making sure that our patients' basic physiological needs are met and making sure that we're providing them with a safe environment, an aesthetically pleasing environment, and all the food, sleep needs that they have in order to actively participate in their care and in group therapy. Then we have our nursing theory. Hildegard Peplau is one of the most popular nursing theorists for psychiatric nursing, and she created two prominent theories, one being the interpersonal relations in nursing. And this theory created empathetic linkages and emphasized the importance of the nurse-patient relationship. Empathetic linkages is the ability to not only empathize with your patient, but the ability to convey that empathy and to let them know that you might not necessarily know what they're going through, but that you can understand that it can be very difficult for that patient and that you're there to support them. The levels of anxiety is another format that we frequently refer to, and this is categorizing anxiety as mild, moderate, severe, or panic level. I'll cover this again when we get to the mental health mini on anxiety, but essentially, the anxiety response can be normal or abnormal, and the more abnormal it gets, the more restrictive it is. So, for example, mild anxiety is a type of anxiety that we're expected to feel. It's a normal response, it's motivating, and it helps us to reach our goals, or it can prevent us from doing something that's harmful for us. Mild anxiety typically does not need treatment. Moderate anxiety is a little bit outside the scope of the situation, and the symptoms that you feel may not necessarily be motivating or preventing you from harm. It may be more maladaptive. With moderate anxiety, we can usually control it with self-care intervention. Severe anxiety is going to be much more severe, and it often requires treatment through medications and different types of therapy. And that's when the response is very maladaptive and outside of the situation. Panic level of anxiety is when someone's experiencing a panic attack, and that can cause them to have a lot of different symptoms that are very debilitating and prevent them from being able to have a healthy response to anxiety. Then we have Imogen King's theory of goal attainment. And this theory basically said that we're a system, an individual is a system, and they work within different systems. They work within interpersonal systems like their family group, their social group, their work group, and that all of these different groups function within society, and society is another system. This theory states that each system acts on all the other systems. So if something changes within society, that's going to affect how groups work. That's going to affect how the individual feels. If the individual takes an action, that can affect how the groups interact, and so on and so forth. So this theory basically focused on the cause and effect of different actions and how we can modify those actions to be good for the individual, good for the interpersonal system, and good for the social system. Lastly, we have Dorothea Orem and Sister Callista Ray's theories. Dorothea Orem's theory, the self-care deficit nursing theory, is a conceptual framework that helps us to identify when we need to go from self-care to actual treatment. In self-care, we have our self-care demands and our self-care agency. Our self-care agency is our ability to end self-care. Typically, our self-care demands and our self-care agency needs to be balanced. When it's not balanced and our self-care demands become more prominent than our agency, that's when we need nursing intervention. Then Sister Callista Roy's adaptation model talks about how we have different stimuli that affects how we cope, how we see ourselves, how we see our roles, how we depend on ourselves versus others, and it also affects our physical and psychological needs, and that drives our behavior. So we can use all these different theories when applying nursing processes and caring for our patients. And thank you for attending this mental health mini.